After the decision to open the chest, the open re-entry sternotomy cart will be brought to the patient's bedside. The open heart boat off the top of the tray will be moved over to a bedside table. Note the peel pack on top are the instruments the surgeon will need to open the chest. Further instruments are located inside the boat, but the primary instruments on the top should be handed to the surgeon first after prepping and draping the patient. Inside the peel pack are a wire cutter, a wire needle holder, and a number 10 scalpel. The outer wrapping is removed first. The inner wrapping is the sterile portion. While the surgeon proceeds to begin the procedure, an assistant will begin opening the tray. Contents inside are sterile, and care must be taken not to contaminate the tray. From this point on, all personnel who handle these instruments should be gowned and gloved.